Hello and welcome. Today, we're diving into a fascinating and complex topic: genetic sensorineural hearing loss. This condition affects millions worldwide, impacting their ability to perceive sound. We'll explore what it is, what causes it, and how we can manage it. So, what exactly causes genetic sensorineural hearing loss? The name gives it away. It's primarily caused by genetic factors. These can be inherited from parents through specific genes, or they can arise as new, spontaneous mutations. There are hundreds of genes currently known to be associated with hearing loss, and we are still discovering more. These genes typically play critical roles in the development and function of the inner ear structures. To understand the impact of these genetic factors, we need to look at the pathophysiology. Sensorineural hearing loss, in general, involves damage to the delicate structures within the inner ear, specifically the hair cells of the cochlea, or damage to the auditory nerve itself. In genetic cases, this damage is programmed by the faulty genes. These genes may cause improper development of the inner ear, early degeneration of hair cells, or malfunction of the neural pathways that transmit sound information to the brain. This disruption in the auditory pathway leads to a reduced or distorted ability to perceive sound. Understanding how widespread genetic sensorineural hearing loss is helps us grasp its significance. Epidemiology studies show that it's the most common cause of congenital hearing loss, meaning hearing loss present at birth. It accounts for a significant proportion of all cases of hearing loss in children and adults. The exact prevalence varies depending on geographic location and population, but it's a substantial public health concern globally. The signs and symptoms of genetic sensorineural hearing loss can vary greatly depending on the severity and age of onset. Some individuals may experience mild difficulty hearing soft sounds, while others may have profound hearing loss. Common symptoms include difficulty understanding speech, especially in noisy environments, a need to turn up the volume on devices, ringing in the ears, also known as tinnitus, and difficulty localizing sounds. In young children, delayed speech development can be a key indicator. Diagnosing genetic sensorineural hearing loss typically involves a comprehensive audiological evaluation. This includes tests like audiometry, which measures hearing sensitivity across different frequencies, and tympanometry, which assesses the function of the middle ear. To determine if the hearing loss is genetic, doctors will gather a detailed family history and may recommend genetic testing. Genetic testing can identify specific gene mutations associated with hearing loss, confirming the diagnosis and potentially providing information about the likely progression of the condition. Genetic sensorineural hearing loss isn't a single entity. While there aren't strictly distinct types in the same way as, say, different types of diabetes, it can be classified based on several factors. We can categorize it by the age of onset: congenital, prelingual is before speech development, or postlingual. It can also be classified based on the genetic inheritance pattern: autosomal dominant, autosomal recessive, X-linked, or mitochondrial. Furthermore, the specific genes involved can be used to further categorize the condition. Each of these classifications helps to better understand the individual case and predict its likely course. While there is currently no cure for genetic sensorineural hearing loss, there are effective treatments and management strategies. The primary goal is to improve communication abilities and quality of life. Hearing aids are a common solution for mild to moderate hearing loss, amplifying sounds to make them more audible. Cochlear implants are an option for individuals with severe to profound hearing loss. These devices bypass the damaged portions of the inner ear and directly stimulate the auditory nerve. Speech therapy and oral rehabilitation play crucial roles in helping individuals adapt to their hearing loss and develop effective communication strategies. Early intervention, especially in children, is essential for optimal language development and social integration. Unfortunately, preventing genetic sensorineural hearing loss is challenging, as it's rooted in our genes. Genetic counseling can be invaluable for families with a history of hearing loss. It can help assess the risk of passing on the condition to future generations and inform reproductive decisions. Avoiding exposure to environmental factors known to cause hearing loss, such as loud noises and certain medications, is also important. Although this will not prevent genetic forms of the condition, the prognosis for genetic sensorineural hearing loss varies widely depending on the specific genetic mutation, the age of onset, and the availability of intervention. With early diagnosis and appropriate management, many individuals can lead fulfilling and productive lives. Ongoing research is crucial for developing new treatments and potentially even preventative measures in the future. Researchers are exploring gene therapy approaches to correct the underlying genetic defects causing hearing loss, which holds promise for a potential cure. Additionally, Advances in cochlear implant technology and speech processing algorithms are continuously improving the outcomes for individuals with severe to profound hearing loss. Thank you for joining us on this exploration of genetic sensorineural hearing loss. It's a complex condition, but with ongoing research and effective management strategies, we can continue to improve the lives of those affected.